Have you ever wondered why some of the simplest, most powerful health remedies rarely make headlines? Why is it that something as ordinary as baking soda, a common ingredient quietly sitting in your kitchen, is almost never talked about for its potential to transform your health? Here's the uncomfortable truth. There's no big money in simple, natural solutions. When a remedy like baking soda water can support digestion, ease inflammation, relieve joint pain, and even promote better sleep, you have to ask, why isn't this common knowledge? Consider this. Over 350 million people worldwide suffer from inflammatory conditions like arthritis, digestive disorders, and acid reflux. Millions more struggle with poor sleep, chronic fatigue, and kidney-related issues. Could something as inexpensive and accessible as baking soda water offer real relief? In this video, we're diving deep into the science-backed benefits of drinking baking soda water at night. And trust me, some of these may completely surprise you. But here's the most important part. At the end of this video, we'll show you exactly how to prepare baking soda water safely, how much to take, and how long to use it to start seeing real benefits without risking your health. Stay with us to the end because how you use it makes all the difference. Drop a comment below and let us know where you're tuning in from. We love seeing how far our natural health community reaches. If you're new here, welcome to the journey. Be sure to hit that like button and subscribe. Your path to better health starts right now. Let's get into it. Quick reminder. The information in this video is for educational purposes only and is not a substitute for professional medical advice. All details shared are backed by professional researchers, with references provided in the description. 1. Relieves nighttime heartburn and acid reflux. You're lying in bed, and that familiar burning sensation begins to creep up your chest. A nightly struggle for many dealing with acid reflux. This discomfort occurs when stomach acid escapes into the esophagus, often due to a weakened lower esophageal sphincter. While long-term lifestyle changes, like avoiding late meals or elevating the head of your bed, can help manage symptoms, many people need fast relief. That's where sodium bicarbonate, better known as baking soda, comes in. Thanks to its natural alkalinity, baking soda helps neutralize excess stomach acid, providing quick, temporary relief from heartburn. In fact, a 2022 study published in BMJ Open Gastroenterology investigated the effects of bicarbonate-rich mineral water on heartburn. The randomized controlled trial showed that participants who consumed this mineral water experienced significant symptom relief compared to those given a placebo. This supports the idea that natural sources of bicarbonate may play a helpful role in managing acid reflux. However, while baking soda water can be an effective short-term solution, it's important to note persistent or severe symptoms should never be ignored. Chronic acid reflux could be a sign of underlying conditions like gastroesophageal reflux disease, GERD, which requires proper medical attention. Always use natural remedies with care and consult your healthcare provider, especially if symptoms continue. 2. Reduces muscle soreness. It's late, and your body still remembers the workout. Tight quads, sore hamstrings, that lingering ache in your shoulders. For anyone who's pushed their limits, this familiar soreness can feel like both a badge of honor and a source of discomfort. But what if your nighttime recovery routine included something as simple and unexpected as a pinch of baking soda? Sodium bicarbonate, best known for its role in baking, has been quietly studied in sports science for its effects on muscle recovery and performance. After intense physical exertion, muscles accumulate hydrogen ions, which lower the pH and create an acidic environment, a key contributor to muscle fatigue and soreness. This is where baking soda comes in. As a natural buffering agent, it helps neutralize that acidity, supporting the body's return to balance. A 2019 study published in Frontiers in Nutrition explored this very mechanism. Researchers found that sodium bicarbonate supplementation enhanced recovery by restoring the body's acid-base balance after high-intensity workouts. By raising blood bicarbonate levels and pH, it helped create a more favorable internal environment for muscle recovery and even primed the body for better performance in future sessions. So while warm showers, stretching and rest remain recovery staples, emerging science suggests that a spoonful of baking soda before bed could give your muscles a much-needed edge as they heal and rebuild overnight. 3. Supports kidney function. Nighttime is when the body enters its most restorative state, a time for healing, regeneration, and internal balance. For individuals living with chronic kidney disease, CKD, this nightly window can be especially important when paired with the right supportive measures. One such measure is addressing metabolic acidosis, a common complication in CKD. This condition occurs when the kidneys can no longer excrete enough acid or retain enough base, leading to a state of internal imbalance that can accelerate kidney decline. Enter sodium bicarbonate. Used therapeutically, sodium bicarbonate helps restore acid-base balance, creating a more stable internal environment that may slow the progression of CKD. A 2021 meta-analysis published in Frontiers in Pharmacology examined the effects of oral sodium bicarbonate in CKD patients. The findings were significant. Supplementation increased serum bicarbonate levels, slowed the decline of estimated glomerular filtration rate, eGFR, a key measure of kidney function, and improved vascular endothelial function, which is vital for cardiovascular health, a frequent concern for CKD patients. Taking sodium bicarbonate at night may enhance its impact by aligning with the body's natural rhythms of repair. However, it's critical to emphasize this should only be done under the guidance of a healthcare professional. Kidney health is complex, and treatments must be tailored to the individual's condition to ensure safety and effectiveness. 4. Helps relieve gout symptoms. Imagine lying in bed, your big toe throbbing with such intensity it feels like it's on fire. That's the cruel reality of a gout flare, a sharp, stabbing pain that often strikes at night, robbing sleep and peace. Gout, a painful form of arthritis, occurs when uric acid crystals build up in the joints, triggering sudden inflammation and intense discomfort. But what if a common kitchen compound, sodium bicarbonate, could play a role in easing that pain? Research suggests it just might. When paired with benzbromarone, a medication that enhances the body's ability to excrete uric acid, sodium bicarbonate has shown promising results. A 2024 study published in the British Journal of Hospital Medicine evaluated this combination and found that patients receiving both treatments experienced significant reductions in serum uric acid levels, fewer visible deposits of uric acid crystals, and improved kidney function compared to those taking sodium bicarbonate alone. Just as important, the combination was well tolerated, with no significant increase in side effects. The science is straightforward. Sodium bicarbonate alkalizes the urine, making uric acid more soluble and easier to eliminate through the kidneys. This not only helps prevent new crystals from forming, but may also assist in dissolving existing deposits. Benzbromarone amplifies this effect by improving the kidney's ability to flush out uric acid. However, this is not a DIY remedy. Excessive use of sodium bicarbonate can lead to metabolic alkalosis, a potentially serious condition caused by elevated blood pH. That's why any such treatment must be carried out under medical supervision, tailored to your unique health profile. 5. Balances the body's pH levels. After a long day of stress, physical exertion, and dietary indulgences, the body's internal chemistry can shift slightly toward acidity. While this change is typically subtle, maintaining a balanced pH is essential for optimal cellular function, enzyme activity, and overall health. Fortunately, the body is equipped with natural buffering systems to keep pH levels within a narrow, healthy range, and one of the most important components of this system is bicarbonate. Bicarbonate ions help neutralize excess acids, stabilizing the internal environment. Interestingly, recent research has explored how external sources of bicarbonate, such as mineral water, can support this natural process. A 2024 study published in the Journal of Nutritional Biochemistry investigated the effects of drinking bicarbonate-rich mineral water on acid-base balance. Participants who consumed 1.5 to 2 liters daily showed a significant increase in urinary pH and a reduction in net acid excretion, indicating a measurable shift toward a more alkaline internal state. This highlights the potential role of bicarbonate, not just from supplements, but from naturally occurring sources like certain mineral waters, in supporting the body's buffering systems, particularly when under increased acid load. It's important to emphasize, while the body is highly efficient at regulating pH on its own, dietary habits can influence this balance. Diets high in acid-forming foods, such as processed meats, refined grains, and sugary beverages, can increase the burden on the body's regulatory systems. Incorporating bicarbonate-rich mineral water may offer a gentle, complementary way to assist with pH regulation. However, it should be seen as a supportive strategy, not a primary solution, and, as always, best approached with balance and awareness of individual health needs. 6. Helps manage urinary tract infection, UTI. Symptoms. As the evening winds down and the body begins to relax, the discomfort of a urinary tract infection, UTI, can become more noticeable, bringing with it burning sensations, frequent urges, and disrupted rest. In such moments, many seek natural ways to ease symptoms, and one surprising option is sodium bicarbonate. The idea behind this approach lies in the pH sensitivity of UTIs. These infections often thrive in acidic environments, and the sharp burning during urination is partly due to the low pH of the urine. By introducing an alkaline substance like sodium bicarbonate, urinary pH can be raised, potentially creating a less favorable environment for bacterial growth and reducing irritation. A study published in the International Urogynecology Journal explored this very concept. Researchers administered oral sodium bicarbonate to female patients experiencing lower urinary tract symptoms, LUTS, alongside acidic urine pH. Over a 4-week period, participants experienced a rise in average urinary pH from 5.31 to 7.2. and significant reductions in symptoms such as urgency, frequency, and nocturia, nighttime urination. The study concluded that oral sodium bicarbonate may be an effective, low-risk option for managing LUTs associated with acidic urine. However, caution is essential. While this approach shows promise, excessive intake of sodium bicarbonate can lead to serious side effects, including electrolyte imbalances and metabolic alkalosis, a condition caused by elevated blood pH levels. That's why this remedy should never be self-prescribed. Anyone considering it should consult a healthcare provider to determine whether it's safe and appropriate for their specific condition. 7. May help influence cancer progression. In the stillness of night, as many seek ways to support long-term health, some turn to unconventional approaches, one of which involves an everyday compound, sodium bicarbonate or baking soda. While commonly known for its household uses, recent scientific exploration has begun to investigate its potential role in cancer therapy, particularly its impact on the tumor microenvironment. A 2024 study published in Frontiers in Oncology examined the effects of sodium bicarbonate on tumor acidity, a characteristic feature of many aggressive cancers. The researchers found that administering sodium bicarbonate helped neutralize the acidic conditions surrounding tumors, potentially disrupting cancer growth. In experimental models, mice with malignant ascites, a condition marked by fluid buildup due to cancer, demonstrated extended survival when treated with sodium bicarbonate compared to untreated controls. The same study also included a compelling case report. A patient with chemotherapy-resistant ovarian cancer who showed a marked reduction in tumor markers and fluid acidity after sodium bicarbonate treatment. These findings suggest that modifying the acidic environment around tumors may interfere with cancer cell survival and proliferation, offering a potential supportive avenue for treatment. However, it's important to be clear, these results are preliminary and based primarily on animal studies and isolated case reports. More robust, large-scale clinical trials are necessary to determine both the safety and effectiveness of using sodium bicarbonate as part of any cancer therapy. As with all health interventions, especially those involving serious conditions like cancer, consultation with a qualified healthcare provider is essential. Sodium bicarbonate is not a standalone cancer cure, but rather a subject of ongoing research that may one day complement conventional treatments. 8. May relieve symptoms of rheumatoid arthritis. After a long day battling the relentless ache in her joints, Maria found unexpected relief in a simple nighttime ritual, a glass of water with a small amount of baking soda. Over time, this practice brought her noticeable ease from the persistent inflammation caused by rheumatoid arthritis, RA. The science behind her experience lies in the way sodium bicarbonate may influence the immune system. Rheumatoid arthritis is an autoimmune condition where the body's own immune system mistakenly targets healthy joint tissues, triggering chronic inflammation, pain, and swelling. A study published in the Journal of Immunology explored how oral intake of sodium bicarbonate can modulate immune activity. Researchers observed a shift in the spleen's macrophage populations from pro-inflammatory M1 cells to anti-inflammatory M2 cells after baking soda consumption. This shift suggests that sodium bicarbonate may help foster a more anti-inflammatory internal environment. For individuals like Maria, this could translate into fewer flare-ups, less joint stiffness, and more restful nights. It's important to be clear. Baking soda is not a cure for rheumatoid arthritis, and it cannot replace disease-modifying therapies. However, its potential to gently influence immune balance offers a glimmer of hope for those exploring complementary strategies to ease their symptoms. As always, anyone considering this approach should consult a healthcare professional first. Sodium bicarbonate, while generally safe in small amounts, can pose risks if misused or taken in excess, especially for individuals with underlying conditions. How to take baking soda at night for health benefits. Safe dosage, timing, and duration. When it comes to using baking soda as a natural wellness tool, simplicity meets science, but the right timing, dosage, and duration are essential. Timing. The best time to drink baking soda water is 1 to 2 hours after your last meal, just before bed. This gives your stomach time to settle and helps reduce overnight acid buildup, which often contributes to discomfort, particularly in cases like acid reflux or arthritis-related inflammation. Dosage. Start with 1/2 teaspoon, approximately 2.5 grams of baking soda, dissolved in 6 to 8 ounces of cold or room temperature water. Stir until fully dissolved and sip slowly. Don't chug. Drinking it slowly allows for better absorption and helps avoid bloating or stomach distension. Duration. If you're using baking soda for anti-inflammatory effects, such as support for rheumatoid arthritis or gout, give it at least 2 weeks of consistent use on alternate days to begin noticing subtle improvements. However, daily long-term use is not recommended unless under medical supervision due to potential risks like high sodium intake, metabolic alkalosis, or digestive imbalances. For general wellness, once or twice a week is likely sufficient and safer over time. Used mindfully, this humble kitchen staple can become a quiet ally in your evening wellness routine, just as it did for Maria. Small dose, big impact. Who should avoid baking soda at night? Know the risks before you sip, before reaching for that glass of baking soda water. It's critical to know this natural remedy isn't safe for everyone. And people with high blood pressure should be especially cautious. Baking soda is high in sodium, and even small amounts can raise blood pressure or strain the heart. If you're on a sodium-restricted diet or taking diuretics, corticosteroids, or antacids, baking soda may interfere with these medications or amplify their effects, leading to electrolyte imbalances, muscle cramps, or in severe cases, alkalosis. And pregnant women should not use baking soda as a remedy unless advised by a doctor. It can cause fluid retention and affect blood pressure during pregnancy. Those prone to bloating or gas may find that baking soda worsens symptoms. When it reacts with stomach acid, it releases carbon dioxide gas, which can lead to discomfort. Gender. People with a history of heart disease, especially congestive heart failure, should avoid it entirely. The sodium load can increase the heart's workload, posing serious risks. Bottom line, baking soda is not a one-size-fits-all solution. What helps one person sleep better or ease inflammation could be harmful to someone else. Always consult your healthcare provider before starting any new remedy, especially if you fall into any of these categories. Now it's your turn. Are you already using baking soda water at night? Have you noticed better digestion, reduced inflammation, or improved sleep? Share your experience in the comments. Your story might inspire or help someone else on their wellness journey. And if this video helped you, type yes in the comments. That one word might seem small, but it motivates us to keep bringing you science-backed natural health content. Don't forget to like, share, and subscribe if you haven't already. Your support means everything to us naturally. Thanks for watching, and as always, take care of yourself.